by Christina Jewett and Robert Louis Kaiser. Health news workers at Garfield Medical Center in suburban Los Angeles were on edge as the pandemic ramped up in March and April. Staffers in a 30-patient unit were rationing a single tub of sanitizing wipes all day. A May memo from the CEO said N95 masks could be cleaned up to 20 times before replacement. Patients showed up COVID negative, but some still developed symptoms a few days later. Contact tracing took the form of texts and whispers about exposures. By summer, frustration gave way to fear. At least 60 staff members at the 210-bed community hospital caught COVID-19, according to records obtained by KHN and interviews with 8 staff members and others familiar with hospital operations. The first to die was Dewey Liang, 60, a quiet radiology technician who never said no when a colleague needed help. A cardiology technician became infected and changed his final wishes, agreeing to intubation, hoping for more years to dote on his grandchildren. 10 months into the pandemic, it has become far clearer why tens of thousands of healthcare workers have been infected by the virus and why so many have died. Dire PPE shortages. Limited COVID tests. Sparse tracking of viral spread. Layers of flawed policies handed down by healthcare executives and politicians, and lax enforcement by government regulators. All of those breakdowns, across cities and states, have contributed to the deaths of more than 2,900 healthcare workers. A 9-month investigation by over 70 reporters at KHN and The Guardian has found. This number is far higher than that reported by the U.S. government, which does not have a comprehensive national count of healthcare workers who've died of COVID-19. The fatalities have skewed young, with the majority of victims under age 60 in the cases for which there is age data. People of color have been disproportionately affected, accounting for about 65% of deaths in cases in which there is race and ethnicity data. After conducting interviews with relatives and friends of around 300 victims, KHN and The Guardian learned that 1/3 of the fatalities involved concerns over inadequate personal protective equipment. Many of the deaths occurred in New York and New Jersey, and significant numbers also died in southern and western states as the pandemic wore on. Workers at well-funded academic medical centers, hubs of policymaking clout and prestigious research, were largely spared. Those who died tended to work in less prestigious community hospitals like Garfield, nursing homes and other health centers in roles in which access to critical information was low and patient contact was high. Garfield Medical Center and its parent company, AHMC Healthcare, did not respond to multiple calls or emails regarding workers' concerns and circumstances leading to the worker deaths.